Thank you, Governor. Good afternoon, everyone. I do want to congratulate the Governor publicly. We look forward to continuing the important work that we have to do for Rhode Islanders. So as you can see on the screen, our data overview shows that our COVID-19 situation in Rhode Island has remained stable. We have 375 new cases to report today of 19,550 tests for a percent positivity of 1.9%. Our overall weekly percent positive rate increased slightly from 2% to 2.1%, and that's something we are obviously keeping an eye on. We know that some specific communities also did see increases, which drove our overall statewide increase. We also announced earlier this week that 4 additional cases were identified with the new variant. So putting those pictures together are items that we want to continue to monitor closely and cautiously. The good news is that our hospitalization data continue to improve. We have 148 people currently hospitalized. Our number of total new weekly hospital admissions is 125, down from 176 the previous week. Overall, our hospitalizations are down by about 73% from their peak in November and December. Although we very sadly have 5 new COVID-19 associated fatalities to report today, our overall fatality data continues to hold steady. Our COVID-19 associated fatalities are down 84% from their peak in December. That's important, knowing that saving each life is what this is about. And as I've shared in previous weeks, our decreases are even more significant in the groups where we focused our vaccination efforts early on in phase 1. Those include healthcare workers, residents in nursing homes, and other congregate settings. As we know, we have since expanded our vaccination efforts and are continuing to make important progress. To date, we have administered almost 290,000 doses of vaccine, which is roughly 25% of Rhode Islanders 16 and older that have received at least 1 dose of the vaccine. That's important. That's a number we want to continue to grow. We are administering almost 8,000 doses a day in Rhode Island when you look at a 7-day average compared to what we were doing in earlier months. That administration rate is up by 210%. As a reminder, we have 3 public channels for accessing vaccination: our retail pharmacies, and then our regional or municipal-run clinics, and our state-run sites at the Dunk and at Sockanosset Crossroads in Cranston. As I announced last week, we will open new sites in Middletown and Woonsocket shortly. The Middletown site will open first, either next week or the following week. For our state-run vaccination sites, we are currently registering people who are 65 years of age and older. That's true for eligibility across all of our 3 public channels. From that eligibility standpoint, we are working as hard as we can to move as quickly as we can to our next 2 groups, which are simultaneously people who are 60 to 64 and people 16 to 64 who have underlying health conditions. As the governor shared, we are planning to get educators vaccinated, and we're doing this while continuing to stay on schedule with our next groups that have been mentioned. We set out mid-March as our target for those groups, and we're committed to meeting that target while continuing our focus with the educators. We're getting a little help with the immediate addition of doses of the Janssen vaccine, which is also called the Johnson & Johnson vaccine. It was deemed safe and very effective by the FDA, and our Rhode Island COVID-19 vaccine subcommittee recommended yesterday that Rhode Island go ahead and begin administering this vaccine. We received 9,100 doses on Tuesday night and are distributing them now and working on getting them into our existing public channels for administration. That means our state-run sites, our local and municipal sites, as well as clinics in our high-density communities, hospitals, community health centers, and other places. We will also eventually be using some of this vaccine for homebound Rhode Islanders and other targeted communities that would benefit from a one-time dose. Of note, the Johnson & Johnson vaccine performed very well in clinical trials against the new variants of COVID-19, which is extremely valuable for us. And it was 100% effective in clinical trials in preventing hospitalizations and keeping people alive, preventing deaths. That's also tremendously important news and directly aligns with a big part of our focus. The last update on our vaccination campaign that I want to provide is on the work happening in our communities that are hardest hit, focused on getting people vaccinated. Central Falls is the good news. We've had some amazing success there. Roughly 34% of adults in Central Falls have received at least one dose, and 93% of Central Falls adults 65 and older have received at least one dose. Since we started vaccinating in Central Falls, we have seen a 63% decrease in cases. However, we know that we have much more work to do in our other communities that have similarly elevated case rates and elevated rates of hospitalizations. That means Pawtucket, and that means specific zip codes in Providence. The good news is we have the model of what works. We know what works because we saw it work in Central Falls. It's about being in the community, engaging people, being creative on how we are accessing them, whether it's going door to door in housing authorities or food pantries, or engaging with community organizations and churches, and using a number of creative strategies while partnering with trusted community leaders so that we can bring down barriers to vaccination. We have that model, and we are determined to be able to apply it in the communities that need it the most. Those are the updates I have on the vaccination campaign. And as we are continuing to say, we have the 3 tools that are critical to get us through the final phase of this. Vaccination is one of them. It's also testing and treatment. So continue to please access the tremendous capacity we have for testing, treatment, and vaccinations as we continue to roll that out. Before opening things up for questions, I want to finish with adding in information about testing as well as treatment. On testing, as a reminder, we have a testing program for businesses. You can get free Binax Now rapid test kits to do regular testing of employees within your businesses. We have also opened a call center to support businesses taking part in this program, and this is a great way to meet people where they are and contribute to reducing the spread of COVID-19 in the workplace, while minimizing disruptions to productivity and staffing in the workplace. To learn more, you can go to health.ri.gov and look at the announcement we have posted there on our homepage about testing supporting businesses. Also with testing, we are doing a new round of serology testing. Serology testing looks for proteins in the blood called antibodies, which are produced by the body in response to the presence of a virus. Serology testing tells us whether someone was previously exposed to COVID-19. We sent out letters to 10,000 randomly selected households about getting tested. Testing is available now through March 12th. We had done this successfully earlier on in the pandemic response, and we're excited about the opportunity to see what we can learn now. If you get a letter, we're asking you to please consider taking part in this study. This kind of information that we can learn from this testing is incredibly important for the planning we're doing around COVID-19 in Rhode Island now and into the future. Vaccinations, testing, and treatment. A final reminder about treatment. We have very effective COVID-19 treatment for older adults, 65 years of age and older, and for people with underlying conditions regardless of your age. I've talked over the last few weeks about Rhode Island being a national leader in reducing hospitalizations and reducing fatalities. A lot of that is because of our approach to the vaccination campaign, but we've also said that our leadership with testing and our work with treatment have also played an important role. Please make sure that you have the information that you need if you were to test positive and have symptoms and you or a loved one are 65 years of age and older, or you are an adult with some underlying illness. To learn more, visit covid.ri.gov/treatment. Treatment is available even if you don't have a doctor. We want everyone to be able to access the resources that we have available and help us get through to that great summer in Rhode Island that we're looking forward to.